This presentation is on a case study of a drug-resistant salmonella outbreak that occurred due to cattle. Before I get into the information about the outbreak, I wanted to give a little bit of background information on salmonella. First, some history. It was discovered by Dr. Salmon. It has been known to cause illness for over 125 years. The illness that you actually get from the salmonella infection is called salmonellosis. Every year, there's over 1 million salmonella illnesses reported, and from that number, there are 19,000 people that are hospitalized. Of those people, 380 people die annually from a salmonella infection. Some symptoms of salmonella include diarrhea, fever, and abdominal cramping. These symptoms usually show up around 12 to 72 hours after you're first infected with the disease. Usually, the symptoms last 4 to 7 days. Most people are able to recover without treatment, but some people are hospitalized due to excessive diarrhea, which causes dehydration. The infection can also spread from the intestines into the bloodstream and other body parts, which can lead to hospitalization and can also lead to death. Who is most at risk for getting salmonella? The elderly, infants, and those with impaired immune systems, who are generally at risk for other diseases too, are the ones who are most at risk for contracting salmonella. But children have the highest risk for contracting it, with children under the age of 5 having the highest rates of infection among everyone. To diagnose someone with salmonella, it requires testing of a clinical specimen, which would include stool or blood, in order to definitively know that it is salmonella that's causing the symptoms and not another disease that also has the same symptoms. Most of the time, the effects are what are stated on the previous slide: diarrhea, abdominal cramps, etc., and only lasting 4 to 7 days. But there can be other prolonged effects as well. A small number of people develop pain in their joints from being infected with salmonella, which is known as reactive arthritis. This can last for months or even years, and people who already have arthritis, those people can have worse arthritis from salmonella. Now into the case study of the actual salmonella outbreak. So the salmonella outbreak was linked to a 4-H project's Wisconsin livestock. What happened was there was an outbreak of Salmonella Heidelberg. There were 36 confirmed cases, and 13 of those included people who were hospitalized. No one ended up dying due to this, though. The first illness that was related to this outbreak was reported on January 27th, 2015, and the last one was on January 16th, 2017. The outbreak was not reported to the public until around November 2016, but they were able to track back cases as early as January 27th, 2015, due to the same strain, and they were able to classify those illnesses into this outbreak. The people that became infected in this outbreak were aged 1 to 72 years old, and 60% of the people were female. This outbreak covered 10 states and it was linked to sick calves, including dairy bull calves, that were purchased from livestock markets in the state of Wisconsin. This picture right here shows a picture of the 10 states that were affected by this outbreak. The first state, California, had 1 ill person. Iowa had 2 people fall ill. Idaho had 1 person fall ill. Minnesota had a total of 4 people. Missouri had a total of 6 people. North Dakota had a total of 1 person. Oklahoma had a total of 1. South Dakota had a total of 4. Texas had a total of 1. And Wisconsin had a total of 15. Of the 36 people that were interviewed for having come down with the salmonella illness, 25 of the people reported that they did indeed have contact with dairy bull calves or other cattle before becoming sick. Some of them also reported that they became sick after their own dairy bull calves had become sick and died. Isolates from the ill people were tested and were closely related genetically to one another. This close genetic relationship most likely means that the people in this outbreak were likely to share a common source of infection. More investigations were able to identify sick calves, including dairy calves from the livestock markets in Wisconsin, as the likely source of most of these infections. This was due to the fact that the isolates from the ill people and the isolates from the dairy bull calves and other calves were closely related. Some of the calves in this outbreak were also used with 4-H projects, which helped the spread of the salmonella outside of the farms. Following and during this outbreak, health officials advised the public to wash their hands thoroughly after touching livestock, equipment, and other animal-related items, and especially before eating or drinking. Lastly, a couple of ways that salmonella can be prevented. As stated on the previous slide, the washing of hands after the handling of animals before eating and drinking, etc., but also doing things such as cooking poultry, ground beef, and eggs thoroughly, and not eating or drinking undercooked or raw eggs or meat or raw unpasteurized milk can lessen the chances of contracting salmonella. Washing of things such as hands, kitchen work surfaces, utensils. Wash those with soap and water or some type of antibacterial cleaner after they are in contact with raw meat or poultry in order to kill the salmonella bacteria. Making sure that if you're preparing foods for those who are easily affected by salmonella, such as infants and elderly, immunocompromised, making sure you handle those foods with extra care. Avoiding direct contact between reptiles, especially turtles, because they are known to carry salmonella. And making sure that you don't work with raw poultry or meat and an infant around the same time.